Hi, nurses. Welcome to Shift Change, the podcast for nurse leaders who are ready to shift their thinking from just a nurse to claim their position as a powerful agent for change. I'm your host, Amy Deagle, founder and CEO of the International Network of Nurse Leaders. We believe in the power of nurses to change the world, so let's get started. Marcie Smigorowsky is passionate about having an impact on healthcare and advancing the role of the nurse practitioner. She started 33 years ago as a registered nurse, graduating from the University of Alberta Hospital Nursing Program. She then obtained a Bachelor of Science in Nursing from the University of Alberta, as well as a Master's in Nursing to become a nurse practitioner. She obtained a PhD in medicine this past year. She has had the opportunity to work in many different areas of cardiology throughout her career, from the Cardiovascular Intensive Care as a staff nurse, educator, cardiac rehabilitation nurse, pacemaker, and device nurse, to her current roles as a nurse practitioner in the Cardiac Ease Clinic and the Mazankowski Atrial Fibrillation Program. She has also taken on a leadership role as a professional practice leader for the Advanced Practice Nursing Edmonton Zone. Currently, she is on secondment from that role to CARNA as a nurse practitioner policy and practice consultant. I am thrilled to have Marcie here with us today, and without further ado, we will get to the interview. So thank you everybody for joining us today. Marcie, welcome to the Shift Change podcast.
Thanks for having me, Amy.
I know we've had multiple restarts trying to get this podcast actually recorded, and so I appreciate your patience, but such is the life of busy nurses and odd schedules, hey?
I think that is true. That is the life of balancing different roles and challenges.
Yes. All right. So, Marcie, you have an amazing career that you've had so far, and so I would just love for you to dive a little bit deeper. I just let the listeners know about your, official bio, but I love the story that we can really get into. So do you want to take us through your nursing career journey into leadership and just some of those highlights you've had so far in your career?
For sure. So I didn't go into nursing as soon as I was done school. I kind of did a few different jobs along the way, which taught me, I would say, what I do like and what I don't like. And so I went in a little bit later. And so in that nursing class, as we all came together, and I did start through one of the hospital programs, which we had many years ago, we needed to have someone who would stand up and be a leader for the class. And Amy, you and I have just talked about that there can be that pang for what you need to do. And I felt that pang that I should step forward and say I would be the president for the class. And I just thought, what do I know? What do I have to bring? And therefore sat back and then stepped forward and was the vice president of the class. So I always felt kind of that pull right from the very beginning and was that representative for the class. And then as I went through the hospital program, I knew right away that I wanted to go back and complete my degree. It was at that time where we were really talking about entry to practice, and I knew that I loved nursing and I wanted to be able to give more, and therefore went back and did my degree. But I've always continued to work while I was going to school, but would always try and take on some form of leadership. When I came out and was a brand new nurse, I was very lucky and got to go right where one of my passion spots is, which is cardiology. And I had two fabulous nursing leaders at that point, and who respected the staff and really encouraged us to be our best and be involved. And I think that those were two role models that and mentors that I've carried with me throughout my career that has really helped me step forward. And so as I went through cardiology at that point as well, was a very respected ward by many in the hospital. We ran the codes, the pediatric codes, really all of the hospital codes. We did, as part of the coronary care unit, we did air transport before there was such a thing as STARS. And so we were always kind of seen as these leadership folks. And so from there, I was able to go on to cardiac rehab. I did the CCU educator first because I felt I wanted to give something back to the nurses. I wanted to help them be able to develop their expertise in different areas. So when I started nursing, it was before we had thrombolytics, and so patients were quite sick when they had their heart attacks, and so thrombolytics came forth. So it was a really busy time, and so being an educator, it was pretty exciting and rewarding and challenging because it was very different type of care when we started that. And then was able to go, I wanted to touch the patients a little bit more. And so I went into cardiac rehab for a while. And then I knew I wanted to do more, and so I went and became a nurse practitioner. I truly love patient care and wanted to make a difference for the patient's experience and how do we meet their needs a little bit more. So this is way back, this is kind of in the beginning when we really started thinking about patient-centered care. And my role as a nurse practitioner has been very rewarding, but that leadership piece has followed me. I became an informal lead for the nurse practitioners here at this site, and the nurse practitioners would come to me to ask, and we'd work together to try and find solutions because we really were in the beginning, and there was no defined role for us per se, and we were really trying to lead how nurse practitioner care is very different from physician care. That then ultimately led to a more formal role and leadership for myself, and that is where the advanced practice professional practice leader for the Edmonton Zone. So that encompasses for the CNS role and the NP roles, and that I've been doing for approximately 3 years, but recently have been seconded to CARNA as the NP policy and practice leader. We need that direction through CARNA. We've been very focused with nursing and having to advance nursing practice, and that's been very exciting. I've been engaged in that work as well in my role as a nurse practitioner. I sort of worked a little bit as a CNS to have the nurses in our clinic work to full scope of practice. But we really needed to have someone at CARNA who understood the NP role and what are some of the standards, what are some of the things that we really needed to have in place with the NP role. So I feel like the leadership piece just keeps evolving and changing, and as opportunities come up, just stepping forward and trying to have an impact there somehow or some way, and hoping that I'm following some of my mentors and connecting with them and making the helpful choices. Sometimes there's a few roadblocks, as most everybody knows in their career, that get set up. But overall, I've been very fortunate to have a very successful career, in my opinion, and very rewarding.
I love that. And so I just want to dig in a little bit more to the advanced practice nursing, the NP role. It looks different in every country. And so we can speak, specifically to Canada. But I also am curious your thoughts, how we have it set up here versus how the United States have it set up. So when I did my master's of nursing, it was in the U.S., and I actually became a certified nurse midwife / women's health nurse practitioner. And that was 2 years of just that focus, so it was, you had to have been a labor and delivery nurse for 5 years, and then that whole 2-year master's round the clock type of thing, no break at summer, was really intensive on just that stream. Right. And then when I came back home to Canada, it was like, well, you don't really qualify for a nurse practitioner because you didn't meet our qualifications because it was a generalist role or pediatrics, right? Is there 3 streams now for NPs up in Canada?
Right. So when we first started, so Alberta's a little bit different even than the rest of Canada, because when we started, we really had more NPs going into specialty areas and neonatal. Neonatal really broke forward for us in Alberta, but it's exactly with how you were describing your journey, Amy, is that many of us had a strong career in a certain area, so whether it be cancer care, whether it be emerge, and then critical care. And then we went back in to become a nurse practitioner, and we were allowed to specialize somewhat. So my 2 years, while I did get smatterings, of hematology and, infectious disease, those things that you need in order to round out your knowledge, I really was allowed to focus in cardiology and develop my knowledge and expertise there more in depth. However, that has its limitations. So we had family all ages, we had pediatrics, because of course here in Canada we have the sick kids in Toronto, and then we have the Stollery. And so really that specialty and that expertise we needed here as well. So there's been a large proportion of NPs in that area as well. So we actually had, family all ages was actually one that wasn't utilized as much as the adult and the pediatrics and neonatal. However, then you're limited in where your portability is and the exams. We didn't have a national exam, and so if you were wanting to, go from the Stollery to Ontario and work at sick kids, how does that work with what was your standard of education? And so the real push was to have a national exam so that we would have portability. And thus is why it became more family all ages focused. And then, of course, we still have the adult exam and the neonatal exam where they are just in the process of working on. But that was how it changed, Amy. And I think, I'm not sure how the review process went, but I think you kind of got caught in that changeover when we went from one way to the other way, the pros and the cons of having that portability.
Yeah, and it totally makes sense, to have that national exam. But it's just an interesting model how, we are more into that generalist piece now, having that national certification, whereas the states, they still have like I wrote certification exams.
Yeah.
But yeah, you're definitely more specialized. So tell us a bit about advanced practice nursing and that whole world for you.
So I love advanced practice nursing. I really do. I think we make such a difference and I'm very adamant, we are not physician, and we're moving into a new chart. And here in Alberta, the provincial chart. And so anything that the nurse practitioners have been doing has been kind of labeled as well with physician and no mention of us. And so that's been my bandstand. We're not physicians. We are nurse practitioners. But the NPs, I think I know it's because we are kind of a blend between nursing and that medical care model. And so we see that patient through a different lens. But of course, we're challenging with the system and where do we fit in, and challenging with our colleagues because, as everybody, all professions are moving to full scope of practice, you encroach on other people's, shall we call it, territory or area of care that they're traditionally well known for providing care in. And so it's a bit of a political battle that we've had over the years of really helping to instill that role within the healthcare system so that it's not changing. So if that is a nursing role, a typical RN role, that role will stay there. That is what it is. And while it may change and evolve maybe a little bit with technology and things as it comes, the role itself is very much still the same, whether you be in home care, you be in community, you be in the active hospital, versus the NP role. We've seen over time what happens is the NP role is working to full function, having, positive outcomes that maybe aren't documented or really recorded anywhere. And then often leadership will come or something changes within that team, and all of a sudden they don't see that same need or how that role should function. And so I think that would be something that I would really love to be able to strive for, is to really instill that role within the healthcare system, that this is what an NP does. This is what the NP brings to the table. This is, the benefits of having an NP. Here in Alberta, our funding, majority of NPs are hired through Alberta Health Services. We have some with the primary care networks, which are, of course, our community-based NPs, but they're paid out of a different model. And it seems to be the pay piece that causes a lot of issues. Fee-for-service is not what nurse practitioners are looking for, but they're looking for a funding model that will secure their role. Currently here in Alberta, we're going through a challenging time with funding. New government budgets and those sorts of things. And we all know in healthcare that that's cyclical and it comes around. But everybody's really watching their budgets. And so other healthcare providers, their salary comes from a different pocket of money. And so we also see that shift where they might see that the NP role is very favorable, but I can't hire right now, or I have no money. And therefore, if I take this other healthcare provider and put them into the role, then it doesn't affect my budget. So there's so many things still impacting just how to get the role to be a permanent fixture in the system. It would be nice to have that piece solidified. we know that I think one of the things that challenges it, Amy, and is that the outcomes or the evaluation piece of the NP roles hasn't been done as well. So often when new roles or new clinics are set up, it's not really, there's no real measurement set to see what is the benefit of having that NP there. And because we are nursing, some of what we do isn't always observable or easily or tangible to really say that that is because of that role. However, if we sit and we look at how we could measure outcomes that might do that, and we thought about them before we jump in and do the great work that the NPs do, I think we'd see a lot more of those positive outcomes that we read about in the literature. Mm-hmm. But it's there's just that combination of forces out there. I mean, I would say that is probably true too. Like in my role for advanced practice nursing, it also includes the clinical nurse specialist role. And if we think people don't really know what the NPs do, we could talk about the CNS role. And people even have a harder time understanding what they do. But yet we've lost a lot of our clinical nursing leadership. We have a lot of nursing leaders in operations, but that clinical nursing leadership, in my opinion, comes from a lot of those strong CNS roles who are really helping to lead that clinical practice, at least in the acute care setting. And, their roles are sort of morphed a little bit as well, depending on the needs of the organization as well and how their role fits in. So I think both of those roles are really needed in nursing. They both bring a bit different success to nursing in different ways, but I do see benefit for both of those roles.
Yeah, absolutely. And I mean, one of my things when I was working as a midwife is I was like, this is the answer for rural challenges for getting obstetrical providers, like a nurse practitioner specializing in obstetrics. There's no reason they couldn't be working in rural facilities. And, even just some of those places that are losing their hospitals or losing services because they can't recruit physicians there, a nurse practitioner role is ideal in those communities. So hopefully in the next few years we see trends moving towards that and more recognition for the work that you guys are doing.
I agree. Like the roles that the NPs are doing is so diverse and so interesting that I used to call myself the cheerleader when I was doing the advanced practice PPL role, because I would meet with the NPs and really understand the diversity of their roles and then be able to share that so people really understand what the NP role can do. I mean, from the nurses in emergency in Strathcona, they have made an amazing impact on the care that is provided there in an emergency situation. We have the NPs in the Royal Alec ICU. They work 24 hours a day around the clock and provide care. They're helping to train interns. We have the NPs in community care. I've been very fortunate that the folks have allowed me to go along with them to some of their areas of work and be able to see the impact that they have in different people's homes. We know what home care is for nursing, and then to be able to see that some of these NPs are really their primary care provider and they're going into the home and providing care, or at the remand center. Like, it's just so diverse. It's amazing all the different roles that the NPs have.
So when I did my master's program, I was quite young. Like, I was, I think, maybe 5 years into my nursing degree when I went to school and got that. I'm finding now more of my colleagues who were, at home raising families, that sort of thing, didn't have the opportunity to maybe start a master's program, are now looking at the NP route, but they're struggling with that. Like, okay, I've been graduated out of school for 15, 20 years. Do I really want to go back and take on a master's program? What would you say to somebody that's thinking of the NP role, thinking of a master's in nursing, but struggling with that, like, oh, how am I going to balance all of life, working, all those things?
Well, I just finished my PhD, and I looked at, I've done a lot of all my education, most of my education through the University of Alberta, and we have something called Bear Tracks that tracks the courses and years that you've gone through school. So I went back to do my BSCN in 87, and I think, Amy, I don't know whether this is embarrassing or to be proud of, but I have pretty much every year taken education. I believe in lifelong learning, and it is a balance. Do I have that balance correct? it's what's right for everybody.
Mm-hmm.
But if it's really a passion, and I think the faculties know and are aware that there has to be that flexibility. While we have men in nursing, a lot of we still are strongly a female profession,
Mm-hmm.
and family is so important. And so they're learning how to be a bit more flexible, right? We don't have to be on campus full time. There's online learning programs. There's, Athabasca is huge across Canada with their ability to touch folks and help them get through school. While they kind of recommend, that 2 years, you have that flexibility. I just finished my PhD, and again, maybe it's embarrassing, but life is busy, and so those moms with families, I'm one of them. Father who passed away, daughter who got sick, many things,
Mm-hmm.
and it took me 9.5 years to finish my PhD. But I walked across that stage, and I'm in the same program as my son, who graduated from the University of Alberta this year as well. So
Oh, that's
for
incredible.
those yeah, so for those folks who do want to go back and they feel that passion, it can be done. It is balance. I never ever took away from my family. My son played high level basketball, and I was able to go to his games, his tournaments. I was always there for him. My daughter is in nursing, and I was able to be there and support her and help her through her journey. When my father got sick, I was able to be with him. So I never ever felt that I took away from my family, maybe a little bit more from me to get to meet
Mm-hmm.
everybody else's needs. But if you really want to do it and it's important to you, it's worth it. There were times where I thought that I would quit, and I was lucky to have people on my side who were supportive and encouraged me to keep going. And did I do it as perfectly as I did with some of my other degrees? Probably not. But I am finished, and it feels good to be done and able to move on and do the other things that I've dreamed of. So I would support anybody who's interested to look into the different opportunities and the ways of doing school.
I love that. And I love what you said about being a lifelong learner, right? So even if maybe a formal master's isn't, in the cards right now, there's so much
Mhm.
other learning out there that you can do to start advancing yourself in your practice, whether that's a leadership focus or a clinical focus. There's always learning opportunities available. You just have to come from that mindset. And congratulations also on that accomplishment. That's amazing.
Thank you. Yeah, I agree with you. Even the U of C, and I don't know as much about this program as, but I want to look into it. But it's a stacked kind of degree, and there's
Mm-hmm.
certifications, and you can go for different periods of time and focus on different things. So I heard this morning at the Basque is talking about doing the DNP, and so there's, the U of A has just redesigned their NP program to make it more user friendly. How can we help and support and get the students through? So there are new ways of learning and opportunities in order to be successful.
And I love that schools and institutions are shifting the way they're delivering the content so that it is meeting nurses where they're at. I think that's a wonderful step. So, what advice would you have for nurses at any stage in their career that are looking to get more involved with leadership specifically?
I would say, you know, there was a time I've seen nursing evolve, and I think informal leadership is for everybody. I kind of will call the formal leadership roles those jobs initially you're looking at for to get paid and be employed in, but informal leadership is for everybody. And I don't know whether that's the right term, Amy, but I see that as starting with, when you're first out of nursing, being that professional, supporting one another. I think there needs to be some of that in nursing school. Maybe we need to figure
Mm-hmm.
out how to do that a little bit better, because we need to be this cohesive profession and supporting one another in your learning. And is there a task on the unit, instead of maybe pointing it out, actually let's think about that first, and I've come up with a solution. I've noticed this is an issue, but would this possibly work? Being part of that solution, maybe you see something that some coworkers are maybe not saying or doing something that you think is not quite right, is maybe being that person who stands up to support how what should
Mm-hmm.
be. And some of these things are a little bit challenging, But I think kindness and professionalism, I think those two things really need to come together in nursing, with us respecting one another and supporting one another. And so how some of these things come out, I think is just helpful. If I look at some of our other professional colleagues that we work with, they are very cohesive and they are very supportive of one another, and you don't often hear them ever in public saying or not supporting their colleagues. And I think nursing could learn from that. We have so much to offer, and we're such an amazing profession and impact patient care so profoundly. We need to do the same amongst each other. So really that informal leadership, coming together, finding solutions, and that then will continue to lead on to other, I think, more of those formal leaders, because, oh, you know what? Mary Jo, she's been coming forward, has all these great ideas. There's that zone committee. I think she would be the perfect person to get on that committee, really represent us, and help share her ideas and bring back these other good ideas for us to be able to grow. I think it just feeds on it and will continue to help you on that leadership path.
Mm-hmm. I totally agree. And one of the things I talked about in the Not Just a Nurse Day keynote that I did was, I called it everyday acts of leadership instead of informal leadership, but it's the same thing. And really that professional generosity, kindness, compassion towards our colleagues. Like, people all have a life going on outside of work. And as nurses, that can come into our work lives as well. So just really trying to come from a lens of compassion and kindness for each other as well as ourselves. And it can be, as simple things as offering to help roll a patient, or you know what I mean, like just being in that act of service, I really think is everyday leadership. And I feel like that's where we start. And then, like you said, you're going to get recognized when you're coming to the table with those ideas and coming as a team player, on your organization. But also, if somebody doesn't tap you on the shoulder to say, hey, you might be good at this, but you have an interest, don't be afraid to raise your hand. I feel like so many of us think, oh, I have to be so qualified. I have to have all these letters behind my name. I have to have so many years experience. But if you have the desire and this burning will to do it, I say raise your hand. Amazing things can happen if you just put yourself forward, right?
I totally agree with you, Amy. Those are really good points, because that is so true. Sometimes you can sit in meetings and you can kind of look around and see people are kind of twitching, but there seems to be something that holds them back, right, from bringing forth their ideas or sharing, but absolutely, just do it.
Hey nurses, I just wanted to take a quick break from the podcast and tell you about something really important that's happening. So 2020 has been designated as Year of the Nurse and the Midwife. And it's really great to be celebrating nurses and to be sharing trending hashtags. But what we really need to do is get into action, because it's up to us. And nothing is going to change if we don't make the change. So there's a movement happening and it needs you. We're stronger together. So come join us as we disrupt the status quo and evolve our profession. It's time. We are stronger together. So let's get started. If you want to know how you can join this movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the Year of the Nurse and Midwife, as the year we finally use our collective voice and lead our profession forward. So jump over to nurseleaders.ca/2020nurse for all the details. Now back to the episode. So I just want to quick ask, any go-to resources that you use to help support you in your nursing career and leadership journey?
Yes, they really evolve depending on which role I am doing. I love finding a mentor. I think we need to do more mentorship within nursing. I learn best that way. I
Yes.
I guess I'm a little bit verbal in that I like to kind of put put that information between folks, bounce it off, kind of uh,
Mm-hmm.
get feedback. How would you do this? So I think that is one thing that I think will be really positive with the membership with the International Network of Nurse Leaders is being able to maybe connect and feel safe in an area and find that some mentorship or at least work together. But
Mm-hmm.
mentorship I think for is one of those big things. As far as otherwise, I'm a Googler and
Mm-hmm.
looking for articles, things that resonate with me. Because I have gone to school, I feel like, as far as books and things that I would like to read, I have this pile by my bed that will make me
I have a
better.
similar one.
And it just hasn't happened.
Mm-hmm.
And so I have them there and really trying. There's a couple of books that I have that I'm kind of trying to go through and understanding who I am and what type of leadership skills I have and hone, because now I feel I'm at that area where I've always been passionate about patient care. I my clinic days are so busy, but I just feel so good at the end of the day after I'm done. But I would like to participate more in leadership, especially with advanced practice nursing leadership, because nobody understands those roles. And so those are skills that I'm trying to learn and get better at. And I think they will evolve just as, I always think about the stages of our learning and our expertise, right? I think it's Brenner, right? Where I go through the different stages and come back to excellence eventually, and then you start a new role. And that's what I feel like at CARNA. I had kind of reached this excellence with the nurse practitioner role, and now I'm back at CARNA doing more policy work, which I've done before, but this is very different. And I feel like I'm way back at that novice level, right, to try and get back
Mm-hmm.
up. But so that's leadership. I think I don't have a strong resource to share with you. I have a big pile by my beds, but I just don't, because I haven't finished going through them all. I can't recommend which one over the other.
That's all right. We'll circle back at some point in time, get your recommended reads. I was
Thank
going
you.
to say, with the International Network of Nurse Leaders, the membership, we did a mentorship community roundtable last night with Sheena Howard, who spoke on love-led leadership on Not Just a Nurse Day. And it was so incredible to watch these nurses who are leaders in their own practice, but try and figure out how they can put this philosophy that Sheena's created on love-led leadership into their own practice and why some things weren't working. And it was just amazing to see kind of light bulbs go off and, oh, this is how I can implement this, or this is why it's been sticky. So it's amazing how no matter where you're at in your career with leadership, especially, there's always room for growth. And if you come at it in that, like you said, novice mindset, there's always more to learn, because there's always more to learn about yourself,
Uh-huh.
and also, of course, all the resources and systems out there. So it's going to be, great to see how these mentorship calls evolve within the membership. And also, starting in January, we're going to be walking through a leadership challenge that really dives into figuring out who we are as leaders first, so that we know how to lead ourselves well, in turn to lead others well. So that'll be something that's happening very soon. So that's exciting.
That sounds very interesting.
Yeah. So Marcie, like, you have a very interesting lens, because you've done the RN role, you're in the NP role, but also policy and practice. So what do you think one of the biggest challenges facing nursing today is?
Hmm. Right now, I think we have to learn how to be politically savvy. And
Mm-hmm.
I think we need to support one another. There's a lot of different climates, and we have to be able, and I think that's part of leadership, is really understanding and being prepared and having that elevator speech of what's really important and where you want to go, and being able to take opportunities where they come. And so here in Alberta, it's that change piece, because now the government has changed, where healthcare is always looked at with the budget, even nationally
Mm-hmm.
between the different provinces. But how do you advocate? How do you actually show what nursing is doing, and that nursing needs to be here? Nurse practitioner practice, if we talk finances, right, can have a big impact, but it can't be just about the money. It has to also be about the outcome. So you kind of have to bring both of them together. And it's not that nurse practitioners can replace a physician totally, but it's what all that nurse practitioner working to full scope of practice and in which areas. So in primary care, that nurse practitioner may, if they, with the new positions that have been funded, I think there's 31 of them that will come out of project, the monies that they announced, was that in the spring, I think. So there will be NPs with their full panel of patients. So now we really have to show what's happening with those NPs. How are they making a difference in care? Hearing from the patients that they interact with, and helping people understand the impact of having that NP in the clinic. What is that? And then making sure that it comes back to government, because that's ultimately who decides how the funding works, who decides really how the roles can be integrated. Will they open up legislation to allow folks to work to more scope of practice, all of those sorts of things. So for me, it's really nursing working together and supporting one another, and then being politically savvy. And some of our nurse leaders are very good at it, and some I think are learning. But it's really, and then working together, Amy. I sometimes see that there's energy wasted when nursing doesn't work together and support one another.
Well, I mean, it's true that we're stronger together, right? And that's even when I was creating the network. I didn't make it the network of registered nurses. It's for nurses, all nurses. Because we really can learn from each other, and we are stronger together. And if we're working as one voice for our profession, I think that's where we'll find the power we need to make those changes and have the governments, take us more seriously instead of infighting and, some of those things that have historically happened.
Yeah, exactly. Yeah. And I think we have some strong nursing leadership within Canada, and some of it, I think we're maybe at a crossroads with, as we see some of the association and the college changes that we see in some of the provinces, what will be here. We see a difference in how care is provided with virtual, and are you working from Ontario and seeing patients in Alberta? I mean, that's not really an option yet. You have to be, of course, licensed in each province, but I think we're seeing some changes in how healthcare may go, just as we see differences in how education is delivered. So nurses could really have an impact. I do every year. I teach a couple of classes with a guest speaker, really, for the undergrads, and they're so techy and brilliant, and I tell them that all the time. Think outside the box. How can you improve patient care? Nursing is so amazing with all the different roles that we can do. Think outside the box. Come forth with your ideas. I just think that we could really be impactful with how we do care. And so, and then I do usually say something too about, think about that political side. Get engaged, right? And be aware of what's going on in your profession.
Yeah, well, it was interesting. When we did the Not Just a Nurse Day, I had a roundtable of, I call them emerging leaders. So they had less than 7 years experience in nursing, and they were phenomenal. And the large majority of them had political aspirations and, knew that that's where they're going. So it's really interesting that, those were just a random, collection of nurses from all over the world. But really, I think the new generation of nurses coming up do have that more political mindset, that they want to be involved in some of that activism and advocacy work for nursing and for social justice causes. So I think we're going to see a shift towards that. And I'm really excited to see kind of how that evolves over the next few years. Decades.
I agree with you. I think that's very exciting because I get up I tell them it's on my little soapbox, right? And just give me a minute. But I do. It's every time I talk about it, I get very passionate with them, right? And it's like, okay, I'm probably but I do. I see that. I mean, even with the environmental young woman who came across, right? How many, how impactful she is, and she's 15 years old. And so new nurses coming out, there is this different way of thinking. I agree with you, Amy, very much. And they'll be strong.
Yeah. Yes. Yeah. I'm excited to be connected with them and help mentor them along as they learn to use their voices. So very exciting things happening. Yeah. So as a leader in the nursing profession, what change do you hope to impact, Marcie? What would you like your legacy in nursing to be if you were to look back over your whole career? And I know you're not done yet, but kind of from that lens of when you are looking back at the end of it, what do you hope that legacy and impact is?
For me, I've always loved cardiology, and I'm starting to see a little bit. When I did my PhD, I did a systematic review for outcomes for cardiovascular NP-led care. And I identified we're not very good at documenting our outcomes. We can, shouting our worth. And so really I'm hoping, and I'm starting to get feedback because that was just published in the Journal of Advanced Nursing, but I'm starting to have people reach out to me about different things. And then I'm finishing up my randomized controlled trial for NP-led care for patients with atrial fibrillation. So NP-led care compared to cardiologist care, and are some pretty good outcomes. And people, because I had published a protocol paper, I've had several people reach out to me from the States asking me about it and trying to see if my outcomes are done. But I have 8 more patients and then all done. But so really bringing that forward is really because I want to have an impact on NP care. And because it's cardiology, if we could instill that role within cardiology, that would be lovely. But really it's throughout wherever for people to really understand that NPs aren't trying to take over from physicians, and we are not physicians. We're NPs, and we provide care in a different way, and the things that we focus on. I work in specialty, and there is no way that I will have the knowledge that an electrophysiologist has, but there's other pieces to that patient's care where I have a huge impact on, and so us together, we can help meet the needs of patients who are really struggling and have no quality of life, and so we can work together to make a big difference for them. So if I could somehow, whether my little wee study of 150 patients can somehow make people think and see the outcomes are there and see that we can work together, and then people be more accepting of instilling these roles into practice, like so that this is actually a role that's going to stay. We had, for example, why I get passionate about it, we have an NP who was one of CNA's 150 recognized practitioners. She's amazing, well known for everything that she does, such a strong NP, and she's always been a great colleague to work with. I learned from her, and they changed her role, and she is now a CNS. She is no longer an NP. And that makes me very sad that can occur when it was such an amazing role and outcomes were shown, but things changed, and they just felt that they didn't want a nurse practitioner. So if I could have an impact where if this role has been shown to have positive outcomes, that the NP can be impactful in that area, that role should be there no matter who comes and goes within that team. You might modify it because things are always getting better and changes, but to all of a sudden eliminate the role, I just don't think they understand the role. So that would be what.
And that's where, where we need to really come together and use our voice to speak out and showcase our value.
And we really do, whether it be, nurses working to full scope of practice, these new nurses who are going to, as we roll out the RN prescribing, being able to document and say, this is, publish, this is what we're doing. Like, it's pretty exciting. That's not all across Canada, right? And so being able to show our worth and this is what we're doing and being that professional body. So I talk nurse practitioners because it is a passion of mine, but I think it's across nursing that we really need to do that better.
Yeah, I agree. So flipping that then, what are some things that you see happening today that make you proud to be a nurse and proud of where our profession is heading?
The caring piece is amazing. I look at how I'm more acute care based, and so some of that is where my lens comes from. Although I, of course, work with in my Edmonton Zone role throughout. But I look at, I think about back when I was at the bedside, and I look at what's happening at the bedside today, and the number of patients, the working environments. Sometimes I'm amazed at what all they get done. And that's where I think I'm very proud, because they still bring that caring piece into the nursing role. They still somehow, while they're juggling all these balls to get things done safely and delivering fantastic nursing care, they have that caring, they have time for that patient, they have time for that family. And I hear stories all the time about how they impact the patient care, how they've made a difference for those families. They've helped the family is here, they need some support, and they're finding ways to do those little things that maybe make a huge difference. That just warms my heart when you hear stories like that. And we see them throughout my hospital. There's always these bulletin boards, and I always call them the good stories. I'm not sure what the official title is, and I know other sites have them as well, and that just warms my heart. There's many ways that the I'm going to say nursing in general has an impact. Even with Connect Care, with the rollout with the new chart I'm with in the wave one, nursing has jumped on there. You don't hear a lot of them in the media complaining about how it's gone. I've heard them laughing and going, okay, well, now we have to figure this one out. Or, there are stressful days. But I think really, this is a real game changer in how healthcare is going to be delivered. And knowing all the education and the pieces it took to get there, they're jumping up to it. Like in inpatient care, this is a whole different way of charting and documenting, and there's challenges, but overall, I hear nursing being pretty positive about it and trying to get over those hurdles with a positive outlook.
And there's a perfect example of everyday leadership, right? Coming from that positive and, okay, this might be a problem, but how do we troubleshoot it and work together and move forward, right?
Exactly.
So I love that.
Yeah.
So, Marcie, we're just about at the end of our time here. Okay. And before I get to the last two things that I like to cover, is there anything that we haven't touched on today that you would like the audience to know, or any causes that you wanted to champion at all, or any?
One thing that I think is really important, sometimes on your journey, there are going to be those who maybe don't support you the same. Maybe you're going to have bad experiences. I'm very reflective in my practice. I see every opportunity as a way to learn. What can I take from this? And so sometimes it's those negative experiences or those folks maybe that make it more challenging in your life that really actually, if you flip it around, you can see it as a positive experience as well. So, okay, well, that didn't go very well. That is definitely not going to be a characteristic or a quality that I want to embody. How could I have done that better? So taking that and re-looking at it, reframing it, and learning from it, I think you just only win by re-looking at the situation in that way, because there's definitely learning experiences from it. It does not try and push away the negativity. Give yourself 24 hours and then re-look at it and what could I take away from that. I think that's a really important quality to have.
I love that. And it's so important for people to remember, nursing is not going to go smoothly. And the minute you think you have it all figured out, a patient is going to walk through the door, or a situation is going to come up with a staff member that you did not see coming, and it's going to humble you real quick. And, so if we can stay in that learning mindset and really reflect on, okay, so what is this teaching me, or what could I have done better next time? That's how you grow as a person and a leader, right? It's not going to be perfect all the time. You're not always going to know. You're not going to make the right call 100% of the time. But it's in reflecting in those moments of the failure or, hard lessons that really helps you grow as a person to do better next time.
Yeah.
So I love that.
Yeah.
That piece of advice. So, okay, we're going to close with the two elements that I love to close with now. So, Marcie, can you tell us 3 tangible takeaways or 3 pieces of advice? You kind of just did one, so if you have 3 more, great. If not, that can totally count as one that you want to leave the listeners with today.
Well, and I think if you always try and do your best, that is what you can expect from yourself, and that is where outcomes will happen. It may not always turn out exactly how you wanted it, but then you've done your best and you can regroup, rethink, how am I going to do it the other way then? Presenting yourself, sometimes we have I've seen this with, and maybe I'm doing it right now, but being able to communicate and really come across in that professional circus, whether it be standing and doing rounds and you've got everybody together, but just doing your best, presenting yourself in the most professional way that you can, I think really has an impact on how you're viewed as a person, how we're viewed as nursing as a whole, and, just always striving to do well. I think whatever that may mean that is right for you, I think that's a really important thing to always remember. Some days we all have maybe maybe not up to the same par as others, but overall, if we can do that, I think that makes a big difference in life. And I think one thing that I always think about my patient care, and I've had people say this isn't maybe the right words, but really it's treating others, treating whether it be patients, whether it be staff, how you want to be treated. And I know that we're not, maybe then people say to me, well, that's about you. It's maybe not about how Mary Jo would want to be treated. But, if
Mm-hmm.
you're coming from that place, you're being respectful, you're whatever those values are that are important to you, most likely there are somewhere in the other person's value system as well. And so and we've chatted about it earlier, is in treating others as you would want to be treated, but that kindness piece, that really valuing those other people that you work with, and how do you respect them, or the patients, like, because that's where I really come from, is the patient care. So I think that's also a really important quality as well. And I never ask someone to do something that I would never do myself.
Mm. Mm-hmm.
I just feel like whether it be with supporting one another in care, whether it would be with doing tasks, I'm a co-chair for a conference. If I'm not someone who would be willing to do that, I'm never going to ask somebody else to step up and do that either. So working together, when I first started nursing, I had two really good, strong nursing leaders. One was in the coronary care unit, and one was on the cardiology floor. And I worked with both of them. And both of those nursing leaders were very well respected, very influential in clinical care and in nursing leadership throughout the hospital. If they saw me turning a patient or struggling to do something, they would stop what they were doing and come in and help me. And that has always just
Mm.
played a big piece for me, because they had many other things that they could do, but they valued the patients, they valued me, they valued the nursing role, and they were willing to be there always. So that's kind of where that comes from, about, doing your best, and
Mm-hmm.
thinking about how to support one another, and never asking someone else to do something that you wouldn't want to do.
That's great advice. Thank you for sharing that. So, to wrap up, Marcie, I just ask that every guest tell us a story from your nursing career. Anything that's had an impact on you. It can be funny, sad, it really doesn't matter, about patient care, about leadership. It's really just a story that comes to mind that had some sort of impact on you.
So I'm always someone who's always pushing myself, and usually here later than I should be, but I want to phone the patients back. I want to, meet their needs. I just feel that that's really important, and I value that. And I've been a nurse practitioner for about 16 years now, and the role has really changed. And I met this gentleman along my journey, and because I do work in specialty, sometimes people don't stick around a lot, but he had been with me for many years, and he actually had worked for I didn't know him professionally, but he worked as well for the same healthcare institution. And so I would see him, and there were challenges, and we dealt with that. And we often I would phone. I really believe that my it's a hard balance, but I believe I
Mm-hmm.
phone the patients back. I keep my door open in that regard, to be able to have that network with them. And people don't always get the same from other folks. And I think this is where it's the nurse practitioner role, whether it's the nurse in the clinics, but he felt very safe to phone me, and we would chat. And one time he phoned me, and he really wasn't feeling very well. And it was a day where I needed to leave, but I'd known him, and I knew that he didn't often phone just to phone, right? So I phoned him back,
Mm-hmm.
and he really was quite ill, and we worked through a few things and got him to be cared for. And he came back to me. I kind of ended up meeting his wife through a different means. And she shared with me how he would call me his angel, because that day he ended up going to emergency and was quite sick and needed intervention. And she wasn't able to have an influence on him. And so when they both shared with me what an impact, and they tell me I saved his life. He was very ill and wasn't willing to go to emergency. It's really understanding what an impact we can have on patients, and it's that listening and asking them the questions so that you understand, and taking that time to really hear them personally in order to really help them through whatever it is they're going through.
Mm-hmm.
They tell me, because I took that time to really sit and listen, and to allow him to talk about what he was feeling and experiencing, that was what made the difference for them in order to go to emergency. So, and I think that's one of the beauties of nursing, and I just think it helps to exemplify, some of those things. It's hard to say what nursing does, but we really do have an impact, and that took me an extra 15, 20 minutes of my day. It wasn't that I was doing some crazy, fantastic skill that I'd spent, but it was what nursing does. We're there for the patients. We listen to the patients. We plan, we assess, we, put things together. And it just, that has stuck with me. And so much so, he brought it forth down the road for it to be acknowledged a little bit differently. But for me, that wasn't the important piece. The important piece was really my learnings and how impactful it actually was to hear it from him, what that small little piece of my time and what that big piece had to do to his life.
That's amazing. Thank you for sharing. And, it really sums up the notion that I've been saying, everyday leadership, making an impact on people's lives doesn't have to take 8 hours, 12 hours, 3 days, right? It's those little moments that you can sit and make an impact with somebody and create a opportunity for kindness and compassion and just caring for people, a connection. And that has the power to change their life. And, enough of those moments repeated over is really what has the power to change the world, which is really, that vision statement from the International Network of Nurse Leaders is that we believe in the power of nurses to change the world. So thank you for summing that up so perfectly and for taking the time to be here on the podcast. I really appreciate it.
Well, thank you. Thank you very much, Amy, for asking me.
Thank you, everybody, for joining us today. And with that, I hope everybody has a good day. Bye.
Bye-bye.
Hi, nurses. I hope you enjoyed that episode of the Shift Change podcast. I want to take a moment and talk to you about something really important that's happening this year. As you probably know, World Health Organization designated 2020 as Year of the Nurse and Midwife. And while it's important to celebrate the nurses and participate in all these events that are happening, we need to make sure that we are being strategic about making this the year that we really use our collective voice to raise the profile and status of nurses and advance our profession. Understandably, some of you may feel resistance to this call to action. After all, how can we expect nurses to raise the profile and status of nurses and advance the profession when oftentimes nurses aren't even getting a proper break to sit down, eat something, or even use the bathroom on their shift? But you know what? If we don't act and act now, nothing will ever change. No one is coming to save the nursing profession from the burnout and exhaustion, from the staffing crises and nursing shortage, from the violence and bullying, from the budget cuts, and all the other threats to our profession that we are currently facing. Only we can save ourselves. And that can only happen when we decide enough is enough. We must decide that this is the year that we are going to use our collective voice to shout our value to the world, to introduce innovative and revolutionary ideas into healthcare, to advocate for our patients and our profession, to shed the just a nurse mentality and claim our position as leaders, and in doing so, change our profession. This year, 2020, Year of the Nurse and the Midwife, you get to decide. Is this the year that everything changes? Is this the year that we finally say enough is enough and break through the status quo? Is this the year that you, yes, each one of you, decide that you are tired of just complaining and actually put in the work to make a change? Because the truth is, it is up to us. And nothing changes if no one changes. Let me say that again. Nothing changes if no one changes. There is a movement happening and it needs you. We are stronger together. Come join us as we disrupt the status quo and evolve our profession. It's time. It's our time. We're stronger together, so let's get started. If you want to know how you can join the movement of change, visit nurseleaders.ca/2020nurse to opt in for a free 3-part video series about how we can use 2020, the Year of the Nurse and Midwife, as the year we use our collective voice and lead our profession forward. So jump on over to nurseleaders.ca/2020nurse for all the details. I'll see you over there.